Hello, dear friends. Welcome in Homeopathic Canada live session. And today is very important day for us. Today we are going to discuss a role of Organon in day-to-day practice. Today with us, Professor Dr. Subhas Singh. He is a very experienced homeopath from India, and he will join us very soon. First of all, I would like to about him. He is the director of National Institute of Homeopathy. He is the head of Department of Organon of Medicines, Homeopathic Philosophy, Chronic Disease and Psychology in National Institute of Homeopathy. He is the chief editor of National Homeo Recorder. He is the chief editor of Bulletin of National Institute of Homeopathy. He is the editor-in-chief of Journal of Homeopathy. He is the chairman of Scientific Standing Committee, and he is the member of Liga Homeopathica Internationalis. So he has more than 25 years of experience in practical homeopathy. So soon he will with us, and we will start the session today. So if any person during our conversation having any questions, please ask, and sir will answer you guys immediately of your questions. So join together, learn together, so we can use organon of medicine in our daily routine practice. And this will be the uh, practical session for all guys who has uh, doing learn together, so we can use organon of medicine in our daily routine practice. And this will be the practical session for all guys who has doing learn together, so we can use organon of medicine in our daily routine practice. And this will be the practical session for all guys who has doing learn together, so we can use organon of medicine in our daily routine practice. And this will be the sir,
that is what I am trying to do. Somehow it is not working.
Sir, almost your camera in front of you. You have four options: one mic, one video, and one is flipping the camera in your side.
Yeah. And whenever I'm trying to click it, it is coming add comment.
Should be like this.
I got it, but Give me 1 minute.
Sure. So everyone who is joined together, and please, if during session, if you have any questions, please write it down so we can learn more about your queries and more about the practical use of Organon.
I'm leaving and then rejoining.
Okay, sir. So he is the author of almost 9 books. He has done lots of work on organon of medicine. That's why we are here to discuss about the role of organon of medicine in our daily routine, especially day to day, how we can use. Yes, sir. So,
Good enough?
sir, I would like to welcome you, sir, in Canadian homeopathy. So, because it's our urge to learn organ of medicine, and I would like to thank you to accept my offer so we can learn from you. So, everyone, if you have, I say again, if you have any questions regarding homeopathy, because we are discussing basic thing today, absolutely basic. So we can, if you have any questions, ask immediately so sir can give you answer immediately, so there should not be any doubt. So I'm not wasting anyone time. So I request Dr. Subhas Singh, so please start your lectures so we can, if any questions, I will interrupt you and I will tell you the questions about today's sessions. Over to you, sir.
My voice is clear?
Yes, sir. Absolutely, sir.
Yeah. Okay, okay. Thank you very much. Thank you for organizing such webinars, which helps us in continuing our study process. And special thanks for picking up the subject of organon. You know, nowadays it is not so much a popular subject, either in college or in practice. People have an idea that once you pass out, once you start your clinic, don't need so much of organon. Well, uh, those of us who have this conception or idea that we don't need organon so much, I just request them to reconsider how much of their learning and reconsider the result that they are getting. We all want that our result should be like that of our stalwart. They used to, if we go back to old journals or if we go back to uh, old books and see the cases of our stalwarts, then we find that their cases were amazing, miraculous. And we always try that we should also have that such cases. Of course, we can have, but the thing that is required is that in order to have such cases, it is important that we should also follow those methodologies which our predecessors, our stalwarts have followed. Let me share with you a story. When Dr. Kent was practicing, then a young lady doctor, young homeopath, came to him and she narrated her whole problem. After hearing in details, and then Kent has his own way of taking the case. Once he has taken the case, then after that, he asked the lady, since when you are taking laxatives? Now this lady, who was a homeopath, was amazed, was astonished, because in the whole case-taking process, she had not narrated of any incidents of taking laxatives. Then she said, sir, how do you know? But it is a fact that I am a homeopath, so for this problem I have been to many doctors. And most of them have suggested laxatives, and I have been taking laxatives. But I have not shared this with you, so how do you know? Then Ken said, because whatever you are telling me are the symptoms of laxative. So basically, you are undergoing through the process of laxative proving. Now, suppose a patient like this comes to us, which is not exceptional. One can come. Are we in a position to understand that such symptoms which has occurred can be because of the overuse of homeopathic medicine? And this knowledge, this confidence comes from the study of organ. By the way, that lady later on became Kent's second wife. In due course of time, she was Clara Louise Kent, and this is how she was first introduced to Kent. We all have heard of Dr. H.D. Aegidi. He was a very famous physician of Germany at that time, during Hahnemann's time. Later on, he converted and became a very ardent follower of Hahnemann. Once H.D. fell down, at that time he was practicing non-homeopathic method, which was prevalent at that time. So once he fell down, and then he had this paralysis of his arm, and it was very painful. He was not able to move his arm. So he himself was a doctor. He started taking medicine, and he consulted many of the physicians. And they gave their medicine, their leeching or venesection or whatever treatment was used at that time. And his case was going from bad to worse. Then somebody suggested that there is a new system which has been started by a physician nearby, Dr. Hahnemann. So why don't you consult him? So HD wrote down all his problems and sent to Hahnemann the letter. At that time, interaction by letter was very common. And Hahnemann wrote back certain questions. And one of the questions was, do you have any skin disease in your childhood? And HD was very surprised. HD was surprised because he was narrating the whole complaint in the letter to Hahnemann. He had not mentioned anything about this skin disease. And he was surprised because he had a history of skin disease in the childhood, but he never thought any relevant, and he was surprised that why Hahnemann is asking me. So anyway, he wrote back. Hahnemann gave him some medicine, and he took that medicine, and there were 7 doses, and up to the 6th dose, his case was going bad, aggravation, and then he was on the verge of thinking that, okay, I will discontinue. Then he took the 7th dose, and it was all better, and he was so better that he was able to do his regular duties. And just by curiosity that what is this new system, he went to Hahnemann and asked Hahnemann that what was so important that you have to ask me about my skin disease in the childhood. Then Hahnemann explained to him that whatever you were thinking, your pain and paralysis and all these problems are because of the fall, because of the injury after the falling down. It is not so. The fact is there is a relationship between cause and effect. And the effect that you are having that cannot be produced by this cause. So there has to be some other cause. And that cause is your skin disease which was not treated properly, was suppressed. And in due course of time, ASD became homeopath, converted to homeopath. What I am saying this is, why I am sharing this story is to let people know that unless we have this understanding of cause and effect, whenever such patient comes with injury, we'll think of some injury medicine. We'll think of arnica or whatever common injury medicines are there. And I'm not saying it will not produce effect. It will definitely produce effect. But will it produce curative effect? Will it produce those miraculous effects for which Hahnemann and homeopathy is known? If we have to know, if we want those magic, if we want those curative effects, then it is very important that we should go through this book and the guidelines given by Hahnemann, so that we can be rightly guided and we can understand that such type of injury cannot produce this type of effect. For that, there has to be some miasmatic involvement, some history of suppression, or maybe something else. But that understanding. Now, we all practice homeopathy in our own way. And sometimes, let me cite a case. A patient comes and he says, Doctor, I'm suffering from constipation. And my stool is dry, hard, and as if burned. And while further case taking, he further says, Doctor, I am very thirsty. My thirst is for large quantities of cold water at long intervals. And all my complaints, uneasiness, and whatever I have, I feel better when I take it. Now, as a homeopath, what more do we want? It is as if the patient is narrating the line by line of our Medramedica. And there is no doubt, not one iota of doubt, what the medicine will be. We all will agree that this is a wonderful case of Bryannia alba. And then Bryannia alba is given. Maybe many of us will vary in the doses and potency. But as far as medicine is concerned, we will not vary. So Bryannia alba is given. And minimum dose, because so much of similarity. Single dose, as Hahnemann is said. And it produces more results. Definitely a question comes in our mind. Because I have read Organon, I am following Hahnemann, I am giving single dose, I am doing case taking properly. This was a wonderful case of Bryannia alba. So why there is no effect? There should be a wonderful effect. There will never be effect. Because of the simple reason that I have missed a very simple thing. I have missed the aphorism 251, where it is written that medicine like Ignitia, Bryannia, Rustus, and sometimes Belladonna, these medicines have alternating action. And when these medicines have alternating action, your first dose may not act. So how we will know where I have to give repetition, where I don't have to give repetition? And there is the guideline given in Organon. And that is why, my dear friends, it is important that we should read Organon. You know, I always believe that the practice of medicine in accordance with homeopathic method is beauty and simplicity. Simplicity itself. I believe it has to be very simple, very easy. Because unless it is easy, how can it survived for more than 200 years in spite of so much of opposition, obstacles, whatnot. And all homeopaths who practice, definitely, all of us are not Einstein. So it has to be, the only thing required is we have to understand the things. We don't need very high IQ. It's not a complicated system of practice. And I am teaching Organon for almost 30 years. My father, Dr. Mahendra Singh, he was also a teacher of Organon. In spite of that, I believe that Organon of medicine is a very difficult subject, more to teach than to study. Because teaching of Organon is really difficult. Still, I'll just like to say that before reading, ask yourself what Organon is. Is it just a book? Is it just a philosophy? Is it just a guideline? Or it's a combination of all three? Definitely a book. It's definitely a guideline based on philosophy. And those directions, those philosophies are very easy. If you read the whole of Organon, then you will find that the content of Organon can be divided into 4 parts. Let me put it simply. There are the whole content, you can divide it in 4 parts. One is there are discoveries, new things which have not been talked about. Experimental propositions or result of actual experiment. Discoveries like classification of disease, drug proving, one-sided disease, mental disease, all these are new things. And then there are certain instructions or directions for examination of the sick, for preparation of medicine, for giving the medicine on healthy human being. So there are certain instructions. And then there are certain illustrations. Illustrations are theoretical or philosophical. And last but not the least, there are defenses. When people have accused Hahnemann and homeopathy, then he have given defensive argument and sometimes accusation. So these are the basic 4 components of Organon of medicine. If you read it in this way, then you will find what is the right way to follow. You will understand. Because believe me, friends, the biggest problem of homeopathy is not from outside, but it is from inside. It is from inside because the different ways in which principle of homeopathy has been understood and interpreted, and the various mode in which it has been applied, that is a big problem. And that is a problem which is facing homeopathy. In order to know what is the right path, or in order to know the answers of some of the common questions, which medicine to give. Because ideally, if you take a case history properly, then not one, at least 3-4 medicine comes nearby, very near. So out of these 3-4, which one is to be picked up? Which one is to be selected? Then what is the type of disease? Because your approach to the case, your approach of case taking, your approach of selection of medicine, your approach of repetition, everything will change once you have defined what is the type of. And all these answers, how many times the medicine has to be given, how many days the medicine has to be given. When the patient sometimes say, I'm good. Thank you, doctor. But it is only in homeopathy that the patient is saying, I am good. Thank you, doctor. And what the doctor is hearing, I am not good. Who will know this? I passed out my undergraduate from the Calcutta Homeopathic Medical College, the famous, the oldest college in world. And one of my teacher was Dr. Asif Banerjee, Dr. A.K. Banerjee. I remember one of his instances. He was telling us a case that a child, an infant, came with the mother. Mother brought the kid and said, "Ki my doctor, baby is passing 3-4 times stool, not sleeping throughout the night, continuously crying, passing greenish stool, and you see my hands are swollen and I have to carry always. Not eating anything, not taking milk." Sir listened to the whole story and then gave a medicine, whatever was the indicated. And next day, the patient didn't come, the child didn't come. But the mother came and 3-4 relatives came with carrying all the danda and rods, everybody angry. What medicine you have given? You are not a doctor, you are a killer. Why? Before taking the medicine, the baby was passing 3-4 times stool. After taking, now it has increased, it is now 5 times, 6 times. Where is the baby? Baby is just asleep. With so much of difficulty, I made her sleep. You want me to get her just to show you? What the patient is saying, the complaints are aggravated. What the doctor is listening, I'm better. Because asleep, more important symptom to less important. Now, who will understand the meaning of this? And who will tell you this? Who will tell you where no medicine is required? All the treatment protocols are given in Organon. And many a time, patient after the first medicine, some aggravation occurs. When I have to realize that my medicine is wrong, something has gone wrong, my medicine is not correct, some aggravation has happened, we are happy, homeopathic aggravation. Some new symptoms also develop. After the aggravation, along with it, some new develop. Now this is a situation. Now in this situation, should I stop the medicine? Should I change the medicine? Should I change the potency? What is the decision that I should take? And more important than what is the decision, why that decision has to be taken. I can take any decision, but why that decision? What is the rationale? Now this one can know only from Organon of Medicine. Because if you read your aphorism 249, then it is very clearly written that if there is such an instance that produces new troublesome symptoms, not appearing the disease to be cured, is not capable of affecting, that medicine is not capable of affecting any improvement, and it cannot be called homeopathically selected. And if we wrongly wait in such case, thinking that okay, the effect of medicine will pass, it will produce disastrous effects. So this organon, aphorism, words, sentences has to be known and has to be used, applied. Again, I repeat, organon reading is not a difficult thing. Homeopathy is not a difficult system. Only thing required is you have to start practicing. And don't be shy of making mistakes. Just make sure that with every mistake you learn. and next time we don't repeat those mistakes. That is what all is required. A lady came, suppose, a patient, very lean, thin, menopausal age, and when she was brought in your clinic, she was continuously muttering, talking, abusive, not very careful about her dress, trying to, not very modest. And when taking the history, we find that yesterday night there was a history of taking alcohol. After that, this has occurred. So we take the history, we gave the medicine, considering the miasm and recurrence, exciting cause, everything. And as we find that Alzheimer's is a wonderful medicine for the symptom, two, three symptoms that I have given. So suppose Alzheimer's is given. And magic. Next morning, patient is all 100% correct. Nothing wrong. You will not believe your medicine has acted so wonderfully and patient is very normal. You are happy? You are blessing yourself, thanking any man, and ask your patient to go home. And patient asks, or patient family member asks, when should I visit again? You proudly say, no, you don't need to come again. Because everything is normal. After some time, 1 month, 2 months, the same patient came with same symptoms, same abusiveness, same talking, muttering, and again a history of, because she has not taken alcohol, because that incident after that she has not taken alcohol. But then there was some party or something where she went and while talking she took a sip and then she remembered, no. So she took a sip and then she didn't continue, didn't take alcohol any further. And next day she had this problem. Doctor was very happy. Again I will show the magic. And again he prescribed Alzheimer's. Because symptoms were there. And nothing happened. He changed the potency. Nothing happened. Changed the repetition. Nothing happened. Now the same person who was thanking Handyman and grateful to homeopathy now is abusing Handyman. What went wrong? What went wrong was that he has not read his organon properly. He has not read his aphorism 221, 222, 223, where it is very clearly written that in such cases you can give non-miasmatic medicine, non-antisoric medicine, 221, like aconite, belladonna, stramonium, hyoscyamus, mercury, etc. in highly potentized minute homeopathic doses. And that is what he has done. He has given hyoscyamus and it had produced results. But after that, the next step he has not covered. Because next step, 222, clearly said that after that it should never be regarded as cured. What the patient needs now is a prolonged antisoric treatment. Now this mistake, and then in 223 it is clearly written that if the antisoric treatment is omitted, on much slighter cause, one sip, and it will recur, and and from which it will be more difficult to be cured even by the antibiotic. So this mistake, this omission has now endangered the life of a patient, which could have been saved. Homeopathy is supposed to save life, provided it is done properly. And this mistake was done because we have not followed the proper steps. So, like this, these are just some few instances to make you believe that Organon is not only a book or a subject required for passing exams or for decorating in our clinic so that we can see and our fellow homeopaths can see that Organon is near my hand. But it is a book which needs to be understood and practiced more important. That is what is required. Now, doctor, is there any question?
First of all, this was the eyes opening for lots of homeopaths because every single person who did practice and who didn't understand organon in depth definitely is amazed today. Uh, there is lots of questions yes and there are lots of questions no because this is the first interactions and who didn't read organon before because they don't have any questions to ask. Any person who just want to ask questions, you can write it down and I will sir will see these questions and we will discuss this after that because for me and for in Canadian homeopath, they are not used to use these organ of medicine. That's why I many times urge to understand this basic concept because most because I have one experience in 2013 because I got one patient who has lots of eruptions and everywhere is bleeding, pus everywhere and she was taking medicine from last 2.5 years, homeopathic. He gave all medicine, one, two, three, four, five, almost. He gave 55 medicines to that girl, 55 medicines. And she was cured in 3 days. I just told her to take 2 cups coffee and the coffee in after taking coffee there is no eruptions, all pus gone, all bleeding gone, everything, and one week there was no eruptions. I didn't prescribe anything. Such doctors are still there because they are just watching the symptoms and giving medicines. So this is one side, this is the bad luck of us because we didn't understand this basic book. And the other side, we don't have questions because if we don't know anything, how we can ask the questions? So anyone,
But then, doctor, uh, not important that there is a question or no question. What is important is if these words can make one think about reading. I'm sure one day will come when you will start reading.
sir, actually, this is amaze for me because I'm not talking about anyone because I really need. I actually sometimes when you are doing practice, there are lots of difficulty to see the case, and you ask that if somebody says, "Oh, I am good, I'm okay, I have no problem," and doctor says, "Oh, it's a big problem now." It may be a difficult situation will you can face because I have faced these type of problems because many cases when even the most difficult part of any doctor is at home because when he seeing the patients, this is the different thing. When he take seeing his own family member, then the doctor is not become a doctor. He become father or brother or like that. So that time, if you have not understanding of organon, then we will continuously change the medicine because we are not understanding what he want to say. And this happened to me, and I have take 2 months to understand one simple thing, and after that, when I understand, that person become absolutely fine. So after after this incident, I always try to understand, and uh, and I will suggest everyone this book. It helped me a lot because it's this book having a lots of uh, uh, word meaning, because many times if we don't have that much English knowledge or vocabulary, we are always stuck because 99% of people will not read this because they are not understanding the proper meaning of the word. So that's why it become boring.
This was
So
the reason, you know, this book was started by my father, Dr. Mahendra Singh, and he found that one of the main reasons people are not interested or attracted towards Organon is because the translation was done long time back.
yes,
Our words and sentences are very old English, archaic, and uh, one word in one aphorism and the same word in another aphorism have different meaning.
yeah.
So then we compile this and new version with word meaning which is appropriate for that particular aphorism. So the idea was just to help our readers to read more Organon, to find it more interesting and to start practicing based on it. So that was the basic idea.
So I have one more request to you, because this is
Sure.
a basic session today, and my urge, if you give us more time so we can learn more from you, because I think before materia medica or before anything or before starting your clinic, I think this every single person should know about what they are not doing during practice, because everyone know that they are doing this or that, or they are seeing the patients, they are giving the medicine, they have materia medica knowledge, they have repertory knowledge, but nobody says we have a knowledge of organon of medicines,
Sure.
because
Sure.
this is our bad luck. Maybe we can say that this is a bad luck of homeopath, because they are not understanding organon of medicine. So give us time so we can learn more, and people who really want to learn this system. I'm not talking about everyone, because lots of people having a good practice, they have 200, 300 patients, but I don't know how they prescribe the remedy. In Canada, especially in Canada, just one or two doctors are there who really doing a single remedy practice. Maximum are following Banerjee protocol or this protocol or that protocol, or mixture of medicines or the formulas, or they are taking from any other, because I'm collecting everyone so they can learn the exact way what Hahnemann wants to teach. What Hahnemann wants, every homeopath should know these things before they are giving medicine to anyone. It may be a small kid or it may be an elder person. So this is the request to you. Give us some times so we can learn more and more. So we can use single remedy less, as you says, one medicine after giving, and we are happy. Oh, patient will cure, and after that they have the same problem, because we not understanding. what we have to do in these cases?
My dear, it's a promise from my end that whenever we will have any session or anything to do with academic, I am always available. I'm basically an academician and second generation homeopath. So for this purpose, I'm always there. Regarding, without naming anybody, because since I'm two generation homeopath, so I have been fortunate enough to know most of the people very closely, either through my father or by my own self. Without naming anybody, I believe that if there has to be protocol, there is only one protocol, that is Hahnemann's protocol. If somebody is interested in practicing homeopathy, then it has to be Hahnemann's protocol. If you need any deviation, so better to start a new system and call it anything else, but not homeopathy.
Absolutely.
It's as simple as that. In due course of time, people make mistake, they learn and come back.
Yeah.
So you find people coming back to the original, just give them time. And thank to you, young person like you are doing a wonderful job. And I am I must thank you and congratulate you, not only for organizing this program, but more so for your belief in homeopathy.
Yes, sir.
Your belief in homeopathy as it should be practiced, as it has been taught by Hahnemann. That is something very rare nowadays, and I find it wonderful. And I'm sure till people like you are there, homeopathy is safe. So all the best.
Because I am
I
taking one
believe.
thing, sir. I am taking one thing. If I work, if I God give me some time, always I definitely, if I change here in this Western country, one person that converted into absolutely in Hahnemann way, this will be a great achievement because system is with us now. Because we are practicing, we are following the system, and system will continue if other will follow in the same way. So definitely we will soon come back, and any person all around the world, it may be Europe, Australia, England, USA, Canada, any questions after, even after this session, you have any question, any query regarding organ, especially organ of medicine, you can ask. So after second session, we will pick that question first, and after that we will go the basic of this organ of medicine. Because
Sure.
sometimes
I
when
will
we are
also.
interaction, we don't have that question in our mind. After that, we listen it
So
again. Then we have questions. Then we can ask them. So
I would
thank you.
like to take this opportunity to share that recently we have started recording my class lecture and seminar, and we are uploading it in YouTube in my channel. The purpose is only to, so that more and more people should know what is the homeopathy in its pure form and how it also can be practiced. It is not so difficult and it also brings result. That is what the whole aim is. So once more, thank you very much for having me here,
Thank you, sir.
and
Thank you
I
so much
hope
for
you
your
will
time.
continue the good
Also,
work.
we will see you soon again. Thank you, sir.
Sure.
Thank you. Thank
Thank
you.
you very much.